And I'm just gonna show you the instruments for the dental. These are called forceps, and you may see these in your dentist's office. This is actually to extract your teeth. These instruments right here. These are called forceps. When you're doing a cysto tray, which is the urinary system, this actually goes inside the urethra. So they'll use a shorter scope for the female and a longer for the male, because the male urethra goes through the penis, whereas the females are shorter. And if you look at the scope, you can actually put the scope up to the light. You see the light blaring from the scope. That'll let you know that the scope is not damaged. You also need to look in the eye. So you need to look in the eye of the scope and look at the lens to make sure that the lens is not damaged, because you can't send it up. And this is part of that FAN acronym, FAN. It's functional, accurate, and neat. And you always gotta have a cord to go with your scope, because it goes to a monitor, and this is how the doctor sticks it in and looks at the monitor while they're manipulating the scope. And these usually attached to the scope, and it's attached to the machine. So it goes in this way, like that. So for time's sake, I'm just going to put this tray together. I'm going to show you the little bit aspect of it. This is actually an ortho tray. This tray is a foot and ankle set. And when you go and do an ortho, if that's one of your services, you will see that you have a lot of hammers and nails. And when you get to the part where you're doing like a total knee or a total hip or a total shoulder, this is where you get the loaners. So I already printed off the count sheet as from the first week. This is the count sheet for the foot and ankle. So I'm gonna actually put it together. Now this is the way this tray looks right here, like this. This is the tray comes from Decontam, and it came out of the washing machine. And this is how they do it. They actually string the instruments like as so that they all are open. As you can see, they're open. That's to get washed, to get it in. We also have a wire brush. Now this wire brush usually, they don't really want you to use it in prep and pack, and you usually use it in Decontam, but sometimes you may find a little debris on your instrument, so you just actually just scrub the instrument with the brush as so. So we're gonna go by the count sheet, and this is stringers, so that means the stringer, these instruments goes on a stringer. So I'm gonna actually take these out. And how I do my tray, now you can do your tray to your comfort zone. How I do my trays, I do the heavy retractors first. Then I do the stringers. So for time's sake, I'm gonna go a little fast, because I do go fast. So right now, I'm gonna just take all the instruments out that goes on the stringer, just so you can see the retractors and the nails. And when you are doing that, you make sure that you get all your instruments that goes on a stringer. So basically, you're just looking in your tray and making sure that you get all your instruments away from those retractors. So I'm gonna actually set this up real fast. So my scissors, I put my scissors, I usually put my scissors together and just bring them together later. And remember, these were the mosquitoes. These are the tower clamps. And these called Bacchus. These towel clamps are called Bacchus, and it's perforated. Perforated means that it's very, very sharp. So very careful with these because you could actually nick yourself if you're not careful. So I'm going to put these together, and the count sheet is asking for 2 small, which is 3.5, and that's another thing important is to look at the sizes, because that makes a whole difference when you're looking at the sizes. So we need 2 towel clip Bacchus mirror 3.5, which would be these 2. And then we need the same thing, 5 and the 1/4, which would be these 2. Also, when you get your tray from Decontam out of the wash, you have to look for a smaller stringer because that big stringer is to hold the instruments open. This big stringer here is to hold the instruments open. So I'm gonna put my needle holders together. Here are my scissors, and all the needle holders go together. And remember, these are the hemostats. These are the crowds. We're gonna put the crowds together, as well as the. And remember, these are not Kellys. These are Cokers because they have teeth. You see the teeth? They have teeth. So we're gonna put that there. So as you can see, we are matching up everything that's needed to do our tray. So we're matching up, putting on my scissors there. This is a towel clamp or a sponge stick. This is also a Coker. This is the Alice, if you remember from the last video. This is another needle holder. This is a large Coker. So as you can see the difference from the Cokers, you see the difference from, they're both hemostats because they have a ratchet. Now this is the ratchet here, and a ratchet closed. And when you're doing your inspection, which is your function, accurate and neat, you're gonna look and make sure that your instruments are movable. Make sure they close and there's no gap. And I'm gonna put it with the smaller ones. Same thing with these. Make sure that it's movable, it's not stiff. Because if it's stiff, then you have to use oil. And we kind of ran out of oil a little bit, so hopefully the next video I can show you the oil. And just note, the next video, I'm just gonna actually show you all the instruments for the CVOR and the Neuro. I'm not gonna actually do a tray, but I will show you how to wrap. So the next video for next week, week 10, will be wrapping. But I will show you the instruments for those trays that you're learning. Okay, so so when we go to our count sheet, we're gonna look for 2 of the 3.5. So we have that. So right here, I just want to kind of getting a little close. We're here, you have a pre-count, you have a post-count, you got the quantity, which we need, and anything that's missing will go here. You have the CBD count. Let me explain this. This pre-count is what we do, what SPD does. If we find that something is missing, we'll mark it off missing. When it goes upstairs, the nurses and the surgical techs do their count here. And their count had to equal to our count. So if I had 2 towel clips, but I only put 1, but I said it's 2, that means that's a problem. You gotta go exactly by the count sheet. This is why I gave you a mock count sheet in your notes. You must go by the count sheet as you see it. So without further ado, we need 2 mirrors. We're gonna put that on a stringer. We need a 3.5. Then we're gonna need 2 towel clip backers, 5 1/4. Then we're gonna need 4 hemostat curve. I try to let it sit up. So we got this, we got that. So now we need 4 hemostat curve. So these are the hemostat curve. Now remember when I said, it says hemostat curved, but it also could say cryo. So that's the same as that, the hemostat and the cryo. Those are the same. This is what you do. You open it, you look at it, look at the jaw. If you find something, you're gonna scrape the jaw as so. You're gonna take and put them together, make sure that they are the same size of what they ask, and make sure they're movable. So you're gonna put these 4 on the string, and that's there. Then they ask for 2 Halsted mosquito curved. Now, you could just say Halsted. If you see Halsted, it's the same as mosquito. And these are still clamps, and these are still hemostats. But they come in different names. Sometimes it's mosquito, sometimes it's Halsted. But if you see Halsted, you know it's mosquito because the mosquitoes are smaller. As you can see, they're smaller than the cryos. So we have two mosquitoes. Then we have 4 Alice. And the reason why they're clamps, if you can see these clamps, I'm gonna just highlight clamps. If you see where it says clamp, 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 all the clamps have ratchets. This allows them to open and close. So I'm opening and closing, making sure, looking at my jaw, making sure it's not bent, pitted, broke. Make sure that I'm able to move it freely, because you gotta remember when you are in surgery and a physician is doing surgery, it can't be stuck like that. It has to be able to move freely, because it will come down on you. And as you can see, your name, prepared by, it will be, I'll put JD for John Doe, but your name is, your initials are here. So that's why it's important to do your own tray, because you don't want people to sabotage your tray, because they're gonna look at you. They're not gonna look at somebody else, they're gonna look at you. You are responsible for this tray. And make sure they're all together and in the same row as the count sheet. So now it's asking for 2 Coker mirror straight 5.5. So it is these 2 little ones, and they're Coker and they're straight. They're not curved. And that's another thing. And this has something on there. So I'm gonna actually pull it off as so. And that's very important. You need to look. That's our job. Our job is to make sure that it's operational. Then we have a Coker, which is the larger Coker, and they ask for 1. Then we go into the scissors. And remember when I said that the scissors, they do not have a ratchet. They're like your household scissor with the box lock. And remember when I said that the box lock is the hardest part to clean on the instrument. And that is on your exam. So when you see what is the hardest part of an instrument to clean, please put box lock. So I'm gonna spread my scissors out. And the scissors have different names, as you can see. And once we get into the other trays, I'm gonna show you different scissors that correspond with those trays. So now this scissors here, they're asking for 1 bandage scissor This is a bandit scissor. But as you can see, there's two. So that means there's an extra one in here. If there's an extra one in your tray, you just put that to the side. You give them what they ask. So this is a bandit scissor, so we're gonna give them one. And then they ask for a mayo. And remember when I said that the mayos are fatter than the medicine bombs. And they ask for a mayo straight. Now, as you can see, I'm cleaning some of these instruments off. If you come across a tray and you find that it's too, you're doing this too much, then you need to send a tray back to decontam. Because it should not. Sometimes these little marks here are just the pitted. It's from the soap or for the detergent. And you can see whether it's blood or not. And definitely if it's blood, please send it back. But it asks for a mayo suture. It asks for a medicine bomb. Delicate, curved, and make sure you look at these names here. Make sure if it says curve, get a curved one. If it says short, straight, get a straight one. But this one says curved, so I'm gonna put that there. Then it asks for an iris straight. Irises are always small like this. There will never be an iris very long. These irises are always, every time you see an iris, this is what they will look like. This is an iris straight. So we're gonna mark that, we need one. Okay, so we have a Stevens Tetnami, which is straight, and that's the 4 and the 1/4. And if you look at the Tetnami, as opposed to the iris, it has like a small point at the end. So don't mix up the two. The iris do not have a small point, whereas the Stevenson does. And they also ask you for, and they need one of those. And they also ask you for a curve. So as you can see, this one is curved. And it also has a small point to it. So they ask for a curve. So that took care of your scissors. And the way the count sheets, they tell you what it is. So this is a towel clip. And once you get the hang of it, you'll understand that, okay, now you can separate it by what you see. I got my towel clips, I got my clamps, I did my scissors, now into the needle holder. So with my needle holders, I put them in order of size, as you can see. So they ask for a needle holder, delicate, smooth, plastic. All plastic needle holders are smooth, as you can see. They have no ridges, none whatsoever. So this is, they asked for 2, so I'm gonna put that on my stringer. And then the needle holder 6, and it has a groove. So it has a groove jaw, so this is the groove jaw. And that's also, you looking at the jaw, making sure that there is nothing in the jaw, and you also making sure that it's moving. And for the needle holders, you gotta actually make sure that they close tight, because these needle holders hold a needle so they can sew up the wound. And to take it apart, you just squeeze and pull. Squeeze and pull. Okay, so for your exam, okay, so they asked for 2 of those. So for your exam, or they ask you about the working part of an instrument, the working part of an instrument would be the jaw, because the jaw of all instruments is the working part of it. The ring, the finger ring, and they're gonna ask you that on the test about what is the working part. Please say jaw. Okay, so they asked for, so they asked for 2 needle holders, plastic, which we gave them, and then 2 needle holders, Mayo Haggers, which Mayo Haggard, remember the Mayo for the mail scissor, they're fat. So now we have 2 extra ones that we don't need because that's not on our account sheet. So we're gonna put that also to the side. So then they asked for 2 sponge sticks. And these are the sponge sticks. And this is actually self-explanatory. The sponge stick hold a sponge and you dab the wound from blood or fluid. And it's again, squeeze and pull. So now that I did that, I'm going to put that to the side because the stringers are done. And I did exactly what they asked for. Now it says here, bottom of pan, if anybody can see that. At the bottom of the pan, that's what you put at the bottom. So I'm gonna pull out, now, just for the sake of the class, and for time, because my camera person need to go home. But as you can see for the ortho, you see nails. These are pins. See a hammer. That's the hammer on to the bone. You see laminar spreaders. This actually opens up the bone itself. It digs into the bone as so. And the physician opens up as so. They close it and they open it as far as they need. These are called curettes. And the curettes always have like a little circle here with like a cup. What they do is you dig out the bone tissue like the marrow. This is for the actual foot. These are called glammies. So what I'm gonna do is, I just showed you different aspects of it. These are called Addisons, or they're called rongeurs. And you also have, remember these are the Wheatlanters. And remember this, everybody knows this one, that is Army and Navy. And just to note, the other tray we saw Army and Navy. The GYN we saw Army and Navy. The eye, only thing in the eye we did not see the Army and Navy because the Army and Navy is big. And this, imagine this going in your eye. And usually the eye trays have micro instruments, meaning smaller than the original instrument. So I'm gonna actually just spill it all out and make sure there's nothing in your pan. And here's your container. And always get the container that's the size of the pan. So we're gonna put this in the container in the pan. So once you do that, you're gonna line your pan. You're gonna line your pan with a pan liner. And what's the next thing that we do? As soon as you put the pan liner in, you're gonna put in your indicators. And these indicators are your chemical indicators. You remember from the last class, we talked about the different indicators. This is a chemical indicator. The one when you get to sterilization, that would be your biological indicators. But these right here are your chemical indicators. This lets the OR staff know that this tray is sterilized. This white strip turns black. White strip, and you can see it says reject, accept. If you sterilize and it says reject, then you must sterilize this again. If it keeps saying reject, then that means that something may be wrong with the sterilizer itself. So I put it in the tray and make sure there's nothing in the tray at all, nothing. No hair particles, nothing. Okay, well since I dumped that out. We're going to put in the obvious. So right here, these, and I'm going to look at my account sheet. Okay, so this is called a K-wire rack. Here's the rack, which I have. And then they ask for 6 apiece. So you got 1, 2, 3, 4, 5. So you should have 6 of these. 1, 2, 3, 4, 5. Which we do. The OR fills these up. We really don't fill it up. When you do get a tray like this, you can count the individual wires, as you can see. The point is to make sure there's 6. So I put my K-wire in. Remember, we want to make it neat. You can see how I put it in the tray. Okay, so we got our K-wire. And you're gonna mark it to let the OR staff know that you have it. Then we have our hammer. So we're gonna look for that. And usually it doesn't say hammer, it usually will say mallet. And here's the mallet with a nylon cap. It's very important that you read exactly what they're asking for. Here's the nylon cap. And this is, if the nylon cap is off, and sometimes I'm gonna take it off and show you, sometimes it comes off because they're using it, they're cleaning it through decontam. You just screw it back on. If it's missing out of your tray, you make sure the decontam say, did you see it? You know, because that's something that you're gonna want. So we're gonna put it in the tray. We're gonna mark that off. So we're gonna try to get our retractors. Get all the big instruments first. Get all our big instruments. And then now you can start from the bottom. So when you're doing your retractors, as you can see, I'm getting all the big instruments here. And you put everything exactly how that's familiar. All right, so I'm gonna actually go to page, this particular tray has 3 pages. Some trays have 4 pages, but it'll say 2 or 3, 1 or 3, 1 or 4. I'm gonna go here to the back page. And I'm gonna do my carrettes. Okay, so this says carrette runs. Remember when I said about the carrettes? These are carrette, and they always say, it says oval cup. So it's like a little cup here. Here's a cup, and it's asking for straight. So I got 1, it's asking for 1. Now this one here where it says cob, these are cobs. They're bigger and they're fatter. But it is also a carrette, so I'm gonna put that in as well. And also, just let you know that you need a chemical indicator, so we already got that. Okay, so now it says instrument pouch. This is an instrument pouch right here. This is where all your pickups go. But I'm gonna put like the knife handles. And these, remember I was telling you about the ribbon on the Malibu? These are called brain Malibus. They're smaller. As you can see, they're smaller than the ones you saw in the other video. And here's our Army and Navy. So we're gonna put Army and Navy to the side because we don't see that yet. Okay, so first thing it asks for is a elevator peristeel. which would be this one right here. All of these instruments scrape bone. This is what you find in ortho. And when you look in your catalog that I gave you, you'll see these instruments. So they ask for one Periosteal. They ask for one Joseph. So this is the Periosteal, and I'm gonna put it here. And this is the Joseph. Okay, and then it's asking for a forceps. So it's asking for forceps. These are forceps right here. Remember I tell you they like tweezers. These are forceps. So I'm gonna actually take my forceps and put them to the side because I don't wanna do the forceps yet. So I wanna put some more of the larger instruments in the pan. Like I said, you can do it to your comfort. But do it, how they say, work smart, not hard. Don't double track yourself. Work where you're comfortable. Do not rush, because if you're rushing, you will miss something, and that's not good. Okay, so, and remember these right here are called Ragnells. The Ragnells, they don't have any teeth, but the Sens do. So they ask for 2 Ragnells, which is right here. Then they ask for 2 Sen. Two Sens. As you can see, the Sens are different from the Ragnells. See, the Ragnells have no teeth, where the Sens do. Okay, so they're gonna mark that off. And then it's asking for Homans, and these are your Homan. And like I said, check your catalog as you're watching this video. You will see these instruments in your catalog. Okay, so now we're gonna go to the forceps. Okay, yeah, now we're gonna go to the forceps. And remember I said we're gonna put it in our instrument pouch. So we got the forceps tissue with teeth. So you're looking for an instrument, and it's very important that you look at the size. They ask for a 7-inch. So these would be your tissue, and it has teeth. So you're gonna put it in your pouch, and you're gonna mark it off. And then you have your Adson bipolar straight. And this is a bipolar. This is like a quarterology, where you hook it up to a machine and this heats up, and it's like fry a little bit of the blood vessel. So let's say if the blood vessel's bleeding, you could hook it up, and it's gonna go and it'll cauterize that blood vessel so it doesn't bleed. So that's one. And then they ask for a DeBakey. So we're gonna mark it off as we go. And remember when I said about the DeBakeys? They have the ridges. You always see the DeBakeys like this. They have the ridges. And then when we go over the CVOR and you see the DeBakeys, they're gonna look just like this. But they're gonna be clamps. You're also gonna put that in there, and it's asking for 1. Okay, so now it's asking for Adson Brown. I'm gonna show you the difference between the Adson Brown and the Adson. These are the Adsons, and this is what they look like all the time. But the Adson Browns have more teeth than the regular Adsons. They asked for 2. So we're gonna put that in our. And then they asked for 2 Adsons with teeth. Then they ask for the hooks. Now usually you get skin hooks in these trays because they actually hold the skin back. They are what they say they are. And they ask for 2. And skin hooks come in different sizes, so they're asking for 2 hook Joseph. They call Joseph hooks. And they want the double prong. So make sure there's 2, not 1, because sometimes they come as 1. So we're gonna mark that. We're gonna put that in our pouch. Then it asks for a Frere elevator. So this is a Frere, and the Freres always look like this, 2 double side. They ask for 1. They ask for a suction, which is this one. Remember I told you about the suctions? And you must make sure that these suctions are clean inside. So it asks for the suction, so I'm gonna put the suction there, and I'm gonna put the Frere here. Then it asks for a beaver handle. Okay, this is a beaver handle. Some handle, this is the actual blade that comes with the beaver handle. So basically you put the blade here and you're gonna twist it. So this is a beaver, they want 1. This is a number 3, and the handles have the numbers on them, so you won't mess up. These have the numbers on it. See, it says 3. Okay. And then the last is 7. And these are what the 7s look like. And it has a 7 on it. Okay, so I'm gonna put these in with the, so now that takes care of the pouch. I'm gonna wrap the pouch up like such. And I'm gonna take another chemical indicator, and I'm gonna put that in my pouch, because when they look at the pouch, they'll know that everything in the pouch is sterilized. So I'm just gonna put it as such, and just put it in my tray. So that took care of page 3. You're gonna go back to page 2. We're gonna go to page 2. We're gonna go to the osteotomes. These right here are called osteotomes. These are osteotomes. And what osteotomes do, again, they shave the bone. If they wanna, let's say, they wanna set the foot. Let's say the ankle is broke and they wanna fix the ankle, and they don't need to shave the bone down to fit inside what they fixed. This is what they use, osteotomes. So they ask for 5, and we have 5. Those are our osteotomes. So I'm gonna put that in the tray as well. Then it asks for an elevator key. These are elevator keys, and if you look in it, they look like little keys. Sometimes it's like hard to explain, but this is in your catalog. Then it asks for a vertebral spreader with teeth, and these are your vertebral spreaders. So this is the one with the teeth. See the teeth? So we're gonna mark that. And then we have one, a lamina, which is like that. So basically, lamina, vertebral, all of that deals with the bone. So you need those. So I'm gonna put that in there as well. And as you can see in your tray, it's neat. Then we need a bone file, and we need a rasp bone. So we got a bone file, so this files the bone down. These are the ridges, so I'm gonna mark that. And then we have the rasp, which also has ridges. I'm gonna mark that. Okay, then we have the Give me 1 minute. Okay, I just want to make sure. That's another thing. See, you have to make sure that you have what they asked for. So it look like they have an extra number 3. We got to make sure everything is where it's supposed to be. And sometimes it's extra, and if you may ask why is it extra in the tray? It could be that they use something extra and they just put it in the tray, or that when they did the washing, they just put everything together and then mixed it with another tray. Okay, so now we're going to go over the actual, for the bone at the bottom of the pan here. So we got a Rongeur. It says a Rongeur double straight. These are your Rongeurs right here. All of these right here are Rongeurs. So we got a Rongeur bone, and it says curved. We have one that's a double action. Basically, what double action means, so we got those. We got these 3. And then I'll tell you about the McLammys. We got 3 McLammys, and this is what they're asking for. And they're sharp, so if you was to actually run your finger through, that's sharp. We have the bone lister. We have the Wheatlanters. And then we have the Army and Navies. So we have, everything is here. We don't have to worry about nothing missing. So this is how your tray is gonna look. When you do your account sheet, you're gonna actually put your account sheet inside. So that way when they see it, they know it's inside. This is how you put it in your pan. You're gonna put a filter on the top. You're gonna put it over. You're gonna put your locks on. And remember I told you that the locks have chemical indicators. That's the blue. And that blue lock turns into black. That lets us know that it's sterilized. Then you have a label. And as you can see, the initials. So I put my labels on. And that's for people that's doing the sterilizing. And for the OR, so they'll know what tray it is. Okay, so that concludes week 9. And just a note, week 10 will be our last week of instrumentation. And like I said, I'm just gonna show you the instruments, and we're gonna definitely go into wrapping. And I want y'all to do your own wrapping, and you can use Christmas wrapping paper. But it's all explained in week 10. So you have a great day, and hope you enjoyed the video. Goodbye.